Hello and welcome to Focus on Africa, coming to you from BBC World News. Well, Africa has just hit a somber milestone in this coronavirus pandemic. Over 50,000 cases have now been confirmed, with over 1,900 deaths. Now, apart from Lesotho, the tiny nation within South Africa, the entire continent has now been touched by this virus. Although an easing of restrictions is taking place, the fight is nowhere near over. Emphasis is still on testing. But there aren't enough kits. Well, Ghana has adapted their strategy. They're using pool testing. Is it accurate, though? Well, the BBC's Thomas Nardi got exclusive access to a test centre, and he met those on the front line against this deadly virus.
Here at the Noguchi Advanced Laboratories, scientists are busy at work. They are testing samples of potential cases of COVID-19. It's one of the 9 testing centers in the country for the virus. As health authorities intensify contact tracing of all persons who might have been exposed to the virus, the laboratories are now overwhelmed with samples. To be able to respond as quickly as possible, despite low test kit availability, the scientists are adopting an innovative approach. These 10 samples have been put in this test tube and mixed with chemicals and is ready for testing. If it tests negative, what it means is that they are free from the virus. If it is positive, then the individual samples will have to be tested to identify the infected one. Scientists here believe that this is an efficient method to identify the virus. But how accurate is pool testing as it is known?
Before you start, you determine the level of detection, the limit of detection. So you know how sensitive your method is. So you would be 100% sure that the sample that you have determined as negative is negative, and the sample that you have determined to be positive is positive. It's as sensitive as testing the sample alone.
Ghana has ramped up testing with this process, and over 100,000 samples have been tested so far, one of the highest in Africa. The country's infection rate of the virus is 2%. But the pool testing, as it is known, is only efficient while Ghana's infection rates remain low.
The limitations come in when you start getting the majority of your wells being positive, in which case you have to rerun the majority of the pooled samples again. And then you lose the benefit of the efficiency of doing them concurrently that you otherwise would have if the test positivity rate was low.
Ghana's medical drones are also now being deployed to deliver samples to labs. This is to enable authorities identify and isolate infected persons quickly and contain the spread of the virus. And for those who need treatment, the Ga East District Hospital is one of the main centers they are taking to. In this treatment center, they are both young and old patients. This virus doesn't discriminate. And doctors here tell me that more patients have been brought in because the country has increased testing for the virus. This hospital is the front line of the fight against COVID-19 in this country. The hospital has received over 200 patients, and more than 100 have recovered and have been sent home. It's early days, but Ghanaian scientists are already gaining a better understanding of the virus and are now working on developing a vaccine to fight the disease. Thomas Nardi, BBC News, Ghana.
Well, as we've just seen there in Thomas Nardi's report, how Ghana is finding ways to overcome the lack of test kits. But we have to ask, how are other countries coping across the continent? Well, to talk about this, I'm joined by Dr. John Nkengasong, who's the Director of the Africa Centres for Disease Control and Prevention. Thank you so much for your time today on Focus on Africa. So let's just start off then on tests. How do you think Africa is doing on the tests? Because as an organisation, the AU has set a target of 8,000 tests per million. I just want to show the viewers so they get a feel for what's going on. These are some of the figures of countries that have carried out some tests. Nigeria have only carried out 0.009% of that target. And then we have Djibouti, which is leading, the lead tester on the continent, and South Africa, who actually has the most cases of this virus, is only at 0.45%. What's going on?
So thank you for inviting me to be part of this program. We are at war with COVID-19. And you just mentioned a figure there that we crossed the 50,000 infected mark, which is very, very significant. We have to be ahead of the pandemic. And the way you move ahead of the pandemic on the continent is to test. As we speak, as a continent, we've tested, as of today, less than 850 persons. That is really low, as you rightly remarked. So we have to scale this up. But we are challenged with issues related to access to testing. The countries have been testing for years. They know how to test for HIV, for malaria, for tuberculosis, but we just don't have enough access to test to scale up the testing to fight this deadly virus there. So because of that, the chairperson of the African Union Commission, His Excellency Moussa Faki, has launched an initiative called PAC, which stands for Partnership to Accelerate COVID Testing on the Continent, which is underpinned by the tracking, testing, tracing, and treating people. Very simple. So we are aiming to bring to the continent more than 1 million tests in the next 4 weeks, and then scale that up to 10 million in partnership, of course, with WHO and other partners, so that we can at least enable countries to be ahead of the pandemic.
Okay, final quick question on the figures. It seems as if there is a low death toll on the continent. What is it that we're not seeing? You yourself have said that we're possibly not seeing everything that is there. We're blinded to certain things. What's going on? What did you mean by that?
It's very possible that if we are not testing enough, we may not be able to size the burden of our infection. And our concern has always been that are the things we are not seeing going to hurt us? So are we going to see our burst of clusters of the COVID-19 as the pandemic progresses? We may just be lagging behind the pandemic, but I don't really want to be sure that we do not become complacent and believe that our situation is normalizing. I think we are far from that. We really need to continue to intensify efforts and move forward with the testing using the strategy we've put forward, which is a testing strategy.
Okay, now I know that the AU recently took part in discussions with Madagascar. There is a lot of discussion that needs clarifying because this could be detrimental to how people carry out those social distancing measures. And I'm talking about a herbal remedy that's been put forward by Madagascar. It has also been taken on board by a number of countries: Tanzania, East Guinea, Guinea-Bissau, Senegal, Liberia, the Comores, South Sudan are considering it. What's your stance on this?
I think we have issued a statement which recognized the fact that that product was presented at a meeting, a video conference with the head of state and by the president of Madagascar. We've engaged the country of Madagascar, and we are requesting that their scientists meet with us so that we can look into the data, look at issues related to safety, and look at issues related to efficacy of that the tonic. So I think we are very open to discussing with Madagascar to understand the data and to understand how what kind of clinical trials were conducted and what the outcome of that clinical trial was. So we stand by to work very closely with the government of Madagascar to resolve this.
Okay, have you, I mean, like you said, you've requested technical data from Madagascar. Have you received it? And until then, what's your advice to the public? Should they be taking this?
Our advice to the public is simple, that this battle or the war against COVID will be won by informed, science-based decisions, and good decisions should be informed by good science. I think we are saying that no one has a monopoly over this. We are looking for innovative ways to address this, but it should be clinically and scientifically backed.
And yet, this is being branded as a prevention to to contracting COVID-19. This is quite serious.
It is. I think our caution is that we should really be careful that we do not promote things that are not scientifically and solidly tested with respect to the side effects and with respect to efficacy. That is my general message to the entire continent, that there's many claims, and there will be many claims that there are drugs, and we saw this early on in the HIV epidemic. But my caution to the continent is we should only use things that have been proven clinically and have gone through rigorous clinical testing.
I mean, you can say your caution to the continent, but it's not helping, is it? These countries are continuing to import these drugs, these treatments. But off the back of that, what do you feel is the biggest challenges that the continent faces? Because you said in the past that you fear that this is going to get out of control.
Absolutely. I think it should be everybody's fear, given that what we are seeing in Europe, given what we are seeing in the United States and what we saw in China. Clearly, our health systems are very fragile. They are weak. And you do not build health systems and use them instantaneously. You build health systems before you use them. So I think that is the greatest challenge, that if we are overwhelmed and our situation turns out and plays out like what we are seeing in Italy, the Great Britain, Spain, and other countries, then of course our systems will be completely overwhelmed.
And just on the subject of advice, because we're seeing something very similar here in the UK, lots of questions being asked, very pertinent also to Africa, where we've seen, some 13 countries ease their lockdowns. Everybody's now saying, is it too early? In terms of advice, I understand you are supported and you get advice from the London School of Tropical Medicine, as well as Imperial College. Is that advice pertinent to Africa, the African experience, the context?
The context of Africa is very different from the context in Europe or the United States, given our sociology and cultural situations there. So I think we have to contextualize our response and also make sure that it's embedded in the community. This war has to be won within the community, and it has to be community ownership, community leadership, and we build champions in the community to build the trust between government, public health experts, and the community in order to find enabling solutions that will be adapted to our situation.
Okay, Dr. John Nkengasong, it's been a pleasure speaking to you. Thank you very much indeed.
Thank you for having me on the program.